Uganda's COVID-19 positivity rate has dropped from 21% to an average of 3.4% in the past 10 days. Daily average number of confirmed cases have declined and stabilized at 124 cases over the last 1 month from 1,440 at the peak of the second wave in June. Daily average number of deaths have also declined from 57 to 6.
This means we still lose on average 6 people every day.
Hospitalization remains predominant among those above 50 years, and 61% of those who died in treatment units had comorbidities. The Delta variant continues to ravage the country, and the Ministry of Health reports that more females have been infected with COVID-19 in the second wave than males compared to the first wave.
That burials are mostly attended by females. The majority of those who go to pray are females. And of course, they go along with the children.
The ministry has also observed high levels of complacency since the lifting of various sectors from a countrywide lockdown. In September and October, 3 regions have registered intense cases. Teso sub-region in the districts of Soroti, Katakwi, Ngora and Kalaki. Acholi sub-region in the districts of Amuru, Gulu and Inwaya. Lango sub-region in the district of Oyam.
The main drivers of transmission in these districts have been identified as mass gatherings, for example, burials and weddings, weekly markets, the subsequent social activities and interactions, including drinking alcohol after market days.
So far, 2,378,171 million doses have been administered to the population, while 34.2% of health workers, 19.2% of security personnel, 14.9% of teachers, 1.7% of elderly 50 years and above, and 1.8% of people with comorbidities have received full doses of COVID-19 vaccine.
These numbers are still too small. With increased availability of vaccines, I urge those eligible to get vaccinated.
The ministry will receive 5,342,400 doses through donations and 3,260,400 through direct procurement, which will be sufficient to vaccinate 13.5 million people.
Therefore, the priority population of 4.8 million should be fully vaccinated by the end of December 2021.
Meanwhile, the administration of AstraZeneca and Pfizer as first and second jab is proven useful.
The rest is all at a level of a study, so we do not recommend that. And the first recommendation for all countries everywhere is that don't mix.
Dr. Generoth Acheng argues that her ministry is considering mandatory vaccination of health workers.
Civil servants are permanent and pensionable staffs. No one will touch their salaries. But it is important to stay alive, and you have to question yourself whether we have to beg you to stay alive or you want to stay alive.
The ministry plans to have vaccination points in places that attract large congregations and increased rates of transmissions. Ivan Kaahwa, UBC News in Kampala.